Hello, I'm Dr. Fred Venditti, Hospital System General Director. I'm joined today by John DePaula, Senior Vice President for Administration here at Albany Medical Center, bringing you the update. So John, not only are you Senior Vice President right now, but you're also about to become the Interim Hospital General Director, replacing me.
Yes, sir, Dr. Venditti. I've been spending a lot of time with you these days.
You have. So I have a little advice for you in
Thank you.
terms of how to be successful.
Okay.
Grow a mustache.
I've never had one.
Okay.
Maybe
well,
it's time.
Maybe it's time. All right. So let's go to the numbers. Let's pop up the first graph. This is the inpatients around the state. You can see that we're up to 3784. So we continue to have a growth in inpatient cases across the state. The next graphic is the capital region, and we're at 276 today, and we're down a little bit. We had peaked over 300, and so we've settled down a little bit in terms of hospitalizations, John. Which is a good thing.
Which is a good thing,
It is a
obviously.
good thing.
Yep.
The next graphic is here at the medical center, the ins and outs, so the admissions and discharges on a daily basis. And if we go to the fourth graphic, which is our census, you can see we've had a little growth in our inpatient census. We're at 65 today. We have 14 people in the ICU and 4 people on ventilators. We had been a little bit higher, up in the 70s, but the general trend over the last couple weeks has been up, John. So, and we talk every week to our regional partners here.
Yes, we do.
And they're seeing sort of the same thing across the region.
Yep.
Okay. So let's go to the fifth graphic. This is the distribution of variants, John. And what I want to point out here, the Omicron variant is really starting to take hold in the New York State, New Jersey region. This particular graph is what's called Region 2. The CDC calls this Region 2. So that's New York State, New Jersey, and actually Puerto Rico. And what you can see is that last week, the percent of the isolates that were Omicron was 2%. This week, it's 13%. So pretty substantial growth.
It is substantial.
It is. You know, when Delta took over, it took over much slower than the Omicron variant is taking over. And let's go to the last graphic. And John, this is the graphic on efficacy of the vaccines.
Yeah, and as we see, Fred, I mean, there's an ever-widening gap between those that are hospitalized who haven't been vaccinated versus those of us who are fully vaccinated. The blue line represents those that are unvaccinated, and the red line for, again, those of us fully vaccinated. You can see the gap is increasing continuously.
It is, and the black line on top is the efficacy of the vaccine, and that's really holding above 90%. So this really, I think, illustrates a very important point. Being vaccinated is incredibly important for serious illness that winds up putting you in the hospital.
No doubt about it.
Yeah.
Data supports it.
Absolutely does.
Now, Fred, there's a new study, I guess, out of Hong Kong that maybe you'd like to tell us a little bit more about.
Yeah, John, there is. And this is about Omicron. Yeah. So Omicron is really taking over around the world. So the more we understand about it, I think the better. So what the researchers have done in Hong Kong is they've looked at how rapidly the Omicron virus grows, both in tissue from your nose as well as tissue from your lungs. And it turns out that it grows 70 times more rapidly in tissue from human nasopharynx, from your nose, compared to Delta. But it's much, much less likely to grow well in lung tissue. And so it's a very, very important basic science study. It explains why perhaps Omicron is so infectious, because it grows very rapidly in your nose, and that's how you send out virus, through sneezing and coughing. but it also potentially explains why it might be milder.
Right.
And that's because it doesn't really grow well in lung tissue, which is where people get sick.
Right. So important validation to what some of us are hoping for, right? I mean,
Yep.
we appreciate that it's more infectious, but hopefully less severe.
And and the early data out of South Africa seems to go along with that. Some of the reports are that it doesn't cause hospitalization the same way Delta does. And actually, we were talking before we started to tape, the case fatality rate in South Africa has dropped dramatically as Omicron has taken hold. So that might be a clue as well that this version of COVID is going to wind up being milder. So keep your fingers crossed.
Remain hopeful.
Very much so. So, we're still operating under the executive order, John, that causes us to limit some of the procedures we provide. We are adhering to that. We've really, I think, done a very good job of trying to continue to provide as much care as we can while making sure we can handle any surge that might occur because of the both Omicron variant, but COVID in general. So I just wanted to talk about this again. I want to emphasize for any patients who are watching the video, if you have a scheduled procedure here or frankly at any of the hospitals in the capital region, don't assume your procedure is canceled. Please speak to your physician before you make any change in what's going to happen. So very important point for us to make. So John, we've got a number of things going on here within the medical center, trying to address some of our staffing issues. There's one in particular that you're about to kick off.
Yes.
Want to tell us about it?
Fred, sure thing. Like many industries, we're having staffing issues, and one of the areas for the hospital is our hospital unit coordinators, or unit secretaries as they're commonly referred to. And whenever an individual like that isn't kind of quarterbacking all of the information flow coming into the unit, it makes things a little bit more difficult for those clinical providers providing care.
Yes.
So what we've done is we've reached out to all of our workforce, all of the administrative support staff in our workforce, and have given them an opportunity to work some overtime to be a hospital unit coordinator. It's going to require a little bit of training on their part, so they've got to commit to a 4-hour training session to learn some of the systems that we use in the hospital that maybe they don't use in the college or some of their other administrative areas.
That's right.
And we've actually had 70 people sign up to help provide coverage for our hospital unit coordinator role.
That's fantastic. There are many important functions that the coordinators provide on the unit. One very important is they're the first line of critical values that come out of the laboratory and elsewhere across the organization. And it's very important that that information get conveyed properly to clinical folks so that it be acted upon. So very, very important group, and I think this is a wonderful initiative to try to support them and the nurses.
Yeah, the group actually started training this week. Brando Santa Maria has led the training sessions. Brando's done an incredible job. I don't want to leave out Mohammed Al-Mashri. Dr. Al-Mashri also sort of put together the Qualtrics system that we use to have staff sign up. Kudos to both of them. Again, training all week this week, and we're hopeful that next week we're actually going to start to have some of these staff assigned to our units and again help offset some of the shortages that we're seeing with hospital unit coordinators on the units.
So this is terrific, John. If people out there watching the video are interested in doing this, how do they reach out?
Yeah, if you look at one of the messengers that we sent out, I think it was last Monday, there's a link right to where they have to sign up and sort of log in. So look for that noontime, midday messenger last Monday, and you could help us out. We'll certainly look to take on more people to volunteer, no doubt about it.
That's great. Fantastic, John. So a couple of events that are happening today, and this is Thursday, so depending on when you're watching this, they may be done already. The Dean, there's something going on with the Dean.
Yes, sir. We're having the Dean's farewell reception event this afternoon from 4 p.m. to 6 p.m. The Dean's been incredible. I mean, the second longest medical school tenured dean in the country. He's been dean here at the medical college for over 20 years. He's touched so many lives, students, faculty, staff. He's just been absolutely incredible, and we're honoring him today. And hopefully you get a chance to say goodbye to the dean, but it's not actually goodbye, Fred, right?
That's right. So Dr. Verdile has agreed to stay on as Emeritus Dean through, I think, much of 2022. I don't know his exact timing in terms of when he'll finish that role, but he'll be around for a little while longer. You know, John, you mentioned all the people that he's touched. You know, he's also touched us, right?
No doubt.
You've worked for Vince for
17 years.
17 years. 17 years. Wow. And, you know, I've been working with Vince literally since the day I came here. He was chair of emergency medicine when I came as the chair of medicine. And then obviously I've run the practice for him as he's been dean, and the hospital as he's been senior vice president for system care delivery. Absolutely fantastic guy. I view him as a friend, a mentor, and just a absolutely wonderful person. So there's another event today, and that's the Melodies Phone Bank. That's going to be this evening from 5 to 7. So if you're watching this afternoon, please participate in the phone bank. Typically at this time of year, we would have the Melodies program at the Proctor's Theater in Schenectady. But because of COVID, we're being cautious, and that's not going to happen. Those events that we do for the Melodies program really are quite important to the services we provide. We see 1,400 children in the Melodies Center each year. Those are children and families that don't have to travel to Boston, New York, or Philadelphia for cutting-edge cancer care. So it's really important that that we help to fund that program through some of the initiatives, some of the events that we provide each year, and this is one of those events. Yeah. So as I said, it's from 5 to 7. The telephone number, which is on the screen, is 877-810-KIDS. Please pick up the phone and think about making a donation to the Melodies Center. It's important.
Yeah, no doubt, Fred. The Children's Hospital is a tremendous resource to our community, and really the doctors, nurses, and all staff working there do an absolutely incredible job for our pediatric patients.
Yes. So John, I think that's it today. We covered a lot.
Yeah.
This is going to be my last video. I'm also on the launching pad, like Dr. Verdile, to retire. You're going to be stepping into my role January 1st.
Yes, sir.
I wish you lots of success in the role, and I think that's going to happen. Yeah, so we're coming up to the weekend. We thank all of you that are going to be working this weekend, this pre-holiday weekend. And as Dr. McKenna would always say, please take care of yourself and take care of each other.